PowerForm, Module 4. The next section we will discuss is the Procedure Surgical History section. Always start with existing documentation within the screen and verify the accuracy of the information with the patient. Right-click to add, modify, or remove a procedure. Procedures not listed can also be added using the Add button or blue plus sign. Use the search screen or go into the Cerner ICD-10 surgical procedure folder to select the appropriate procedure. Document the surgical date if the patient is able to provide you with one. Your patient had an appendectomy on Christmas 2008. Begin typing in the search box APPEND. Click on the binoculars and select appendectomy from the list. Click OK. Type 12/25/2008 in the date field. If you have additional procedures to add, click the OK and Add New button. When you are done, click OK to close the screen. As with the other controls, your final step in the process is to click the Mark All as Reviewed button at the top of the screen. Now we will go over the social history section of the intake form. Documentation of alcohol, substance abuse, and tobacco histories must be completed on all patients. Remember to start with existing documentation within the screen and verify the accuracy of the information with the patient. If the required histories, alcohol, substance abuse, and tobacco are blank, double-click on the Details column for that category to document use. If previously documented use requires modification, double-click in the Details column for that category and make your changes. Refrain from using the Add button in this section to avoid having multiple entries for a category. Let's double-click in the Details for alcohol use. You are required to complete alcohol use, type, and frequency fields. Click OK. Next, double-click on substance abuse. Complete use, type, and frequency for this category. Click OK. Finally, double-click on tobacco use. You should complete tobacco use, type, and smokeless tobacco use. Click OK. Your final step in the process is to click the Mark All as Reviewed button at the top of the screen. Moving down the menu within the intake form, the Suicide Risk Screening tool provides a good example of conditional field functionality. A specific response to a field within the form will trigger additional fields or forms to open. If the response to any of the first 3 screening questions in this section is yes, suicide precautions are initiated. You will choose yes to question 4, thus opening an additional PowerForm. The Suicide Precautions Plan of Care provides us with examples of multiple types of fields within a form. We want to draw your attention to the name search fields on this form. Place your cursor in the field and begin typing Adigun, A-D-I-G-U-N. Since there is only one Adigun in the system, the field will automatically populate with Dr. Jennifer Adigun's name. In situations where there may be more than one person with the same last name, you will see multiple matches. In this case, you must click on the search icon to display available choices. Select the appropriate name from the list. Once all fields within the form are complete, use the arrow icon in the upper left corner to return back to the suicide screening section. Notice that the Suicide Plan of Care is no longer grayed out in the intake form menu. Should you need to open this section to add or modify documentation on the form, you can now do so from the menu. The next section we will open is the Vaccination Status and Screening section. Notice the 2-column format. On the left side, you will see fields related to the influenza vaccination. As you make your way down this section, your responses will determine whether additional fields will open for documentation. If your patient has not received the flu vaccine, is not an outpatient, is greater than 6 months of age, and does not meet exclusion criteria, they would be considered a candidate for the flu vaccination. By selecting none in the exclusion criteria field, the vaccine will be profiled on the MAR. On the right side of the screen are fields related to the pneumococcal vaccination. The functionality of the fields is identical to influenza screening. If you select none in the exclusion criteria field, education related to follow-up administration will display in the suggested education component of the D part. The pneumococcal vaccine is not administered at Shore Medical Center. Eligible patients will be instructed to follow up with their primary care provider. Let's move to the primary pain section and focus on the fields at the top. Here you will select the pain scale appropriate for your patient. Select 0 to 10, NIPS, or FLAC pain scale based on your patient's age and ability to understand and verbally respond. NIPS and FLAC are conditional fields. As we conclude our overview of the intake form, we want to point out 2 other sections included in the form that are critical for electronic order entry. The order details and vital signs intake sections will be covered in more detail in Module 3. Once you have completed your documentation within each section of the intake form, you will need to sign the form. Click the green check mark in the upper left-hand corner to sign. In this next section, we will cover Form Browser. Click on Form Browser in your main menu. This is where all PowerForm documentation is stored in file format. Remember, at Shore Medical Center, PowerForms should always be signed, never saved, even if incomplete. Form Browser provides you with the means to view, modify, or unchart a signed PowerForm. Notice forms are displayed next to a colored icon. Blue signifies a form where all required fields have been completed. Red indicates an incomplete form. The filter at the top allows you to sort by date, type of form, status, and encounter. To view, modify, or unchart, right-click on the appropriate form. When you select Modify, the form reopens, displaying previously documented information. From here, you can add responses or modify existing documentation. Click the green check to sign the form when done. The form now displays as modified in Form Browser. If you charted in error, right-click and select Unchart. This will prompt you to document a reason. Click the green check to sign. The form will still appear in Form Browser, but will display as in error. This concludes Module 4.